time for the holiday. We got a bad GI virus going around the tri-state.
Medical reporter Liz Bonas talked to local pediatricians today. She joins us now with what you can do to try to keep from catching it. Liz.
Yeah, that's one of those, good luck with that. As you head out for your holiday shopping or family plans, it might be hard to avoid what's giving people this bad stomach bug. We stopped out at St. Elizabeth Pediatrics in Florence today to share just how it is likely spreading and why a frozen treat might be just what the doctor orders to help kids heal. Little Ethan is lucky enough to be in good health this holiday season, but his pediatrician, Dr. John Lacount, says plenty of kids are coming in with what's going around.
Currently, the most common thing that we're seeing is probably the cough and congestion and flu-like symptoms or respiratory types of things. We are also seeing some of the vomiting and diarrhea.
He says some of what's to blame, those holiday hands.
If you touch a surface, if you touch something at the store, touch something at the checkouts, you're going to get your card out, you're putting your little PIN number in. Well, guess what? The PIN number is probably, the pad is probably contaminated. Your hands basically have the bacteria or the virus on them, and then if you touch your nose, your mouth, or your eyes, you've inoculated yourself, and you then are going to catch whatever it was.
That means, he says, hand washing with soap and water reduces risk. Hand sanitizers won't work for these viruses.
They work by desiccating or getting rid of the moisture. The viruses don't have moisture in them, and so what happens is it doesn't get rid of it.
He says what's important to remember is that as you head over the river and through the woods to Grandma's house for the holidays, this may be the one secret step to preventing illnesses from spreading around. And by the way, to help kids rehydrate as they recover from especially the stomach virus.
One of the things that works really well for the kids, though, is popsicles. They have sugar in them, they have fluid, and that usually keeps the kids hydrated and keeps their electrolytes up.
Who doesn't want a popsicle when it's freezing cold outside? I did ask him if he suggested Pedialyte for those that are dehydrated. He says maybe for younger kids, they may benefit from that, especially because in some cases this bad bug lasting up to a week. Most people are over it in about 48 hours.
We're freaking out over the lack of hand sanitizer.
See, I was in Children's Hospital.
Yes.
And as you go from room to room, you are hand sanitizing before you...
But usually before you even go into the units, they ask you to wash your hands with soap and water. What he's saying is when you wash with soap and water, you rinse off or away. When these are moisture sensitive viruses and you just rub your hands in it, you don't remove them.
Wow.
They're still there.
But use it for some. It works on some things.
I mean,
Bacterial?
it's certainly not. If you have a virus that's got moisture, it's not going to help. If there's other things, we get foodborne illnesses that way. There's lots of things that could help. We're not saying don't ever use them. We're just saying it's not the only solution. Hand washing is the best.
I'm walking indoors
He
like
says when
this.
you go shopping,
It's a bad thing to tell a
Don't
worrier.
tell me.
Christmas shopping, you stop in, you should wash your hands every now and then.
Oh, yeah.
All right, Liz.
Thanks, Liz.
All right, we're back.